Assalamualaikum warahmatullahi wabarakatuh. Introduce myself. My name is Izzatunissa, NPM A20210027. Here, I will explain about blood disease, namely anemia. What is anemia? Anemia is a condition when the number of red blood cells is lower than normal. The following are some types of anemia that can occur. 1. B12 deficiency anemia. 2. Folate deficiency anemia. 3. Iron deficiency anemia. 4. Anemia due to chronic disease. 5. Hemolytic anemia. 6. Aplastic anemia. 7. Megaloblastic anemia. 8. Pernicious anemia. 9. Sickle cell anemia. 10. Thalassemia. Next, the following are factors that increase the risk of this problem. 1. Hypothyroidism. 2. Lack of vitamin and nutrients. 3. Have a chronic disease. The causes of anemia include 1. Consumption of certain drug. 2. Is pregnant. 3. Have health problems with bone marrow. Other common symptoms include 1. Always feel irritable. 2. Headache. 3. Have trouble concentrating or thinking. 4. Constipation. Next, some other ways of prevention are 1. Ensuring sufficient vitamin C in the body. 2. Take calcium supplement. 3. Avoid consuming caffeine drink and take vitamin C. Next, I will show a video. Happy watching!
In evaluating a patient with anemia, it is critical to determine if the patient is clinically stable or unstable. Red blood cell transfusions may be necessary in patients with symptomatic anemia, that is, those with angina, hypotension, shortness of breath, palpitations, syncope or presyncope. The hemoglobin value alone does not determine if a patient requires a blood transfusion. Anemia is usually due to one of three processes: bleeding, bone marrow production problems, or hemolysis, which is excessive red cell breakdown. Hospitalized or complex patients may have multifactorial anemia with a combination of the above processes. Anemia can also be classified by red cell size. Microcytic anemia can be due to thalassemia, iron deficiency, or anemia of chronic disease. Macrocytic anemia can be caused by B12 or folate deficiency, alcohol use, chronic liver disease, drugs such as methotrexate, reticulocytosis, aplastic anemia, or myelodysplastic syndrome or hypothyroidism. Normocytic anemia may involve a combination of factors and is best evaluated using a mechanistic approach. In cases of acute anemia, the blood smear must be reviewed to assess for fragmentation of red cells, which may indicate a life-threatening condition such as thrombotic thrombocytopenic purpura, or the presence of blast cells, which are immature white cells seen in acute leukemia. Anemia in the ambulatory care setting may be chronic, and patients may remain asymptomatic for some time. In young menstruating women, iron deficiency is an extremely common cause of anemia. In the elderly, iron deficiency anemia may indicate serious GI pathology, which must be further investigated. In patients with multiple comorbidities, anemia of chronic disease may be present. Multiple myeloma should also be considered in older patients with a normocytic anemia. Investigations will be guided by a thorough history and physical examination. It is important to document any history of bleeding or constitutional symptoms, a family history of anemia, and to review all new and existing medications, particularly NSAIDs or anticoagulants. Basic blood tests should include a peripheral blood smear, reticulocyte count, ferritin, B12, TSH, creatinine, and liver function tests / liver transaminases. An urgent referral to a hematologist is appropriate in patients with suspected bone marrow dysfunction that requires a bone marrow aspirate or biopsy to confirm the diagnosis, or if the patient has abnormalities on blood smear indicating fragmentation hemolysis. To wrap up, in approaching a patient with anemia, first establish if they are stable or unstable. Use 2 complementary approaches to further guide investigations. Determine the mechanism of anemia, either bleeding, a bone marrow production problem, or excessive red cell breakdown. And next, look at the size of the red cells and determine if the anemia is microcytic, normocytic, or macrocytic. Review the blood smear for critical findings such as red cell fragments or immature white cells, which are blasts. Remember, transfuse the patient with anemia only if they are symptomatic.
Thanks. Assalamualaikum warahmatullahi wabarakatuh.